Hi, my name is Kate Brown. I'm a UAM nursing student. Today I'm going to be showing you how to do a Z-Track intramuscular injection. So for today's order we have vitamin K 1 milligram per 1 milliliter, one-time dose. So the first thing we're going to do is we're going to check the MAR, make sure everything's lining up correctly. So we'll check the 5 rights of administering medication. So that's right drug, right dose, right patient, right time, and right route. And then we'll go into the med room, and again we're just going to be getting that vitamin K and making sure with our MAR that everything's correct. And for the purpose of this video, this vial is already reconstituted. So, but this is this is supposed to be for the Z-Track medication vial. So now I'll perform hand hygiene, and I'm going to put on gloves. Okay, so for this video we have a 1 milliliter syringe right here. So then we're going to put this on this one. Okay, so I'm going to put an alcohol pad and wipe down the vial. Okay, so we're just going to wipe the top of the vial. Okay, so now that we have the needle, we're just going to take it off. We're going to draw 1 milliliter of air. Okay, so 1 milliliter air. So we're going to inject into the vial. Just going to push out that 1 milliliter of air. Turn it upside down. We're going to draw out. Oh, wait. Let me go back down. There. Now, I'm going to draw out. Okay. Now I have 1 milliliter. So we're just going to make sure all the bubbles are gone. Just push them all out. There you go. Okay. So now that we have that, we're going to cap the needle. Okay. Okay, we're just going to cap the needle. There. Put that to the side. Okay, and so so now we're just going to remove this needle. Okay, and we're just going to discard of that into the sharps container. Okay, so we're going to get out this other needle. Okay. So then we're gonna check the MAR one more time while we're at the bedside. We're gonna assess the skin, make sure there's no bruising, no inflammation or anything. So at this point I'm gonna take off these gloves. I'm going to perform hand hygiene. Dispose those in the biohazard bag. Hand hygiene. Okay, so I'm going to take an alcohol pad and rub the skin. So I'm going from the inside to the outside. Okay. Now, I'm going to let that dry for a second. I'm going to uncap this needle. Okay. So I'm going to displace the skin to the side like this, and I'm going to go in at a 90-degree angle. So I'm just gonna go straight in. I'm just gonna inject that. Okay, I'm gonna wait a second. Pull it out. Okay, so now I'm gonna cap the needle. Okay, so once the needle is capped, we're going to discard that into the sharps container. So if the patient's bleeding, then we're just going to blot the area. If it's excessive bleeding, we could put a bandage over the cotton. And then we're just going to assess the skin, make sure there's no abnormalities, nothing odd is happening, no inflammation. So that is how you do a Z-track.